Hello, everybody. This is Jason, or else in Hellenic language, it's Iason, which is where Jason comes from, so that everybody knows. Iason means a healer, so that, again, everybody knows. Words have meaning. So this is Iason here, and today I have the distinct honor to have a great scientist with me. Let's basically waste no time, Dr. Levy. How are you?
Good. Happy to be here, Jason. Iason.
Oh, thank you. You're very kind. Thanks for accepting my invitation here. I know that you are a very busy man. I know that you are a prominent author, scientist, and all that stuff. So let's waste no time. I want you, if you have the kindness, to say a little bit about who you are for a couple of minutes or maybe more, just a short bio before I start asking you a few questions. So please, the stage is yours, Dr. Levy.
Okay, well, I'm a traditionally trained cardiologist and internist and got my board certification in both of those some years ago. And for up until about 1993, 94, I practiced regular adult cardiology. And I guess you could say I was a member of the mainstream medical group, modern medicine, shall we say. And this was in Colorado Springs, Colorado. And I had the opportunity to meet and get to know Dr. Hal Huggins, who, for those who haven't heard that name, is, in my opinion, the first real biological dentist on the planet in terms of what he established and what he put forward. And he had a clinic in Colorado Springs, and he brought in patients from around the world and put them through a treatment program of about 2 weeks, nutrition supplementation, and what's called a total dental revision, where he got all the dental infections out, mercury, tonsils, etc. And after I got to know him, he said, "Tom, why don't you come out to the clinic and see what we do?" So I did, and that was probably one of the most memorable days of my life, because at the time there was a elderly lady in the dental chair, looked really frail and weak, and was getting a ton of severe advanced significant dental care, extractions, the type of stuff that I hear when a college student goes and gets a couple wisdom teeth taken out. They get knocked down so bad they go to bed for a week. Well, I saw this lady get 3 hours of dental work, and she just got more and more and more animated. And by the time she finished with this dental work, she was asking her caregiver to, "Let's go out to a good restaurant tonight. I'm going to find some teeth I can chew on, but I want to have a good meal." And it just didn't add up. And Hal was standing there at the time, and I said, "Hal, what's going on?" And he pointed at the IV bag. And I said, "Okay, I know about IVs. What's the secret?" He said, "It's what's in it that counts." I said, "Okay, tell me." And he said, 50 grams of vitamin C. And that just came out of total left field. I had never heard of vitamin C out of the context of oranges like everybody else. Everybody else thinks if they eat an orange, they've taken care of vitamin C and they know everything about it. Well, I immediately knew I couldn't possibly deny what I had just witnessed. And I later also saw other things happen. I saw wheelchair-bound people, multiple sclerosis, not become ambulatory, but after 2 weeks with help, get up and take 1 or 2 steps for the first time. And these were all things that my modern medicine training told me were impossible, didn't exist. So it was literally at that point in time, at the end of that lady's treatment in her IV, I said, "I don't know where this is going to take me, but I need to find out everything there is to know about vitamin C." And shortly thereafter, I became a consultant to Dr. Huggins' clinic and stopped my cardiology practice. And the rest is history, I suppose. It just one thing evolved into another. First wrote a book with Dr. Huggins on just general dental treatment, mercury, etc. Then later wrote one on nutrition, and then certainly my most significant early book, Curing the Incurable, Vitamin C Infectious Diseases and Toxins, came out around 2002, and then about 8 or 9 more books since then. And so with that has come a lot of presentations, conferences around the world, and I'm definitely, I'm not saying I'm happy the pandemic hit. Don't get me wrong, but boy, the pandemic was good to me because I was getting tired of the long distance travel, and now all of a sudden I can do everything I did before on a computer virtually. So it's allowed me to continue to do everything I need to do with full vigor because like I said, 8, 9, 10, 12, 15-hour plane trips were just a bit much for me, even without a mask.
Dr. Levy, this is incredible. I don't know where to start. So, first of all, long trips like this, I've never been in a plane for 15, 18 hours. That's ridiculous. I don't know how you did it. I really can't fathom to be inside a flying thing for so many hours, right? So props to you for doing that in the name of science and helping people. I really admire you for doing that. Having said that, though, you said about the old woman and the vitamin C. So what's happening? So the vitamin C of the woman was when she was doing the dental thing. So she had, at the same time as she was doing the dental corrections, if I might say so, she was at the same time taking the vitamin C IV. Was that
Correct.
the case?
Sure. Well, the important thing to note there that I didn't realize at the time is that vitamin C is your single most important antitoxin and anti-infectious agent. So when you're doing something like invasive dental work, where some infected teeth are coming out, toxins are being released, or if the mercury is coming out, toxins are being released, all of that, when you have the vitamin C circulating inside your blood at higher than regular concentrations, you really get an almost complete protection against any acute or long-term toxic impact of the dental work or the toxin exposure. And this is because, I'll go into a little brief background here so people can more appreciate what else we'll talk about, is that all disease, all conditions are caused by an excess of oxidation compared to antioxidation, or reduction is known. Oxidation is when you take electrons away from molecules, biomolecules, and when a protein, enzyme, sugar, whatever, gets molecules taken away, it's oxidized. And when it's oxidized, it either ceases to function completely or ceases to function normally. So then you start getting a lot of relatively inert molecules inside your cells that can no longer do their job. That's what disease is how many oxidized biomolecules you have, where they are, where they're concentrated. If you have fibromyalgia, the cell doesn't have fibromyalgia. It doesn't have some exotic disease state beyond a unique array of oxidized biomolecules. So all disease then is caused by too much new oxidation coming in compared to the amount of antioxidation that you have. And depending on the person, a large amount of vitamin C and other quality antioxidants, good diet can really improve your health or make you near normal. But for the other patient who has too much unaddressed new toxins coming in on a daily basis, about all you can do is just hold your own or slow the progression of the disease. But ultimately, all disease is new toxins and repair of the damage of old toxins. And then, of course, my work with Dr. Huggins, I came to realize through my experience and the literature that the most significant source of new toxins on a daily basis come from infections in the mouth. Infected gums, infected teeth and root canals, chronically infected tonsils, and infected sinuses. And for most people, if these issues don't get addressed, they really have no chance of ever resolving a disease, and the best they can hope for is to slow its progression, or if the toxicity is not too overwhelming, stop its progression. And just to jump ahead for a second, one of my most recent books, Hidden Epidemic, it turns out, and the literature supports this, even though it's not widely appreciated, is literally 100% of heart attacks from coronary atherosclerosis and blockages comes from a chronic seeding of pathogens inside the coronary artery that come from the mouth. I mean, they've done studies. They've looked at 36. In one study, they looked at 36 out of 36 coronary artery disease patients. They did angiograms and they literally scraped out the plaque, atherectomy, looked at the plaque. All specimens had an enormous amount of pathogens from the mouth inside the plaque. That's what was causing the atherosclerosis to grow. Now, the important thing about this is atherosclerosis, heart attacks, coronary artery disease, this still kills 50% of the population. This is the reason why 50% of the people die. And still, the single most important test is not part of the routine evaluation. And that single most important test is something called the 3D cone beam examination of the mouth. It's a very high sophisticated test that clearly shows you any and all teeth that have infections or abscesses at the root tips. And that's how they present, infections at the root tips. The thing that has kept this test from being accepted, I believe, is that most doctors and most dentists still think that if you have an abscess tooth, it's going to hurt. So you're going to say, Doc, this tooth is hurting me, check it out. No. Well over 95% of these abscess teeth are completely, totally pain-free and symptom-free. And so you're not going to know that you have an infected tooth causing your angina and evolving your heart disease unless you just decide to get this test. It's like if you walk into the doctor's office, the doctor doesn't look at you and say, oh, wow, it's a good thing you came and saw me. I can see that you have a glucose of 275. We better get you on insulin. No, it's completely asymptomatic. And they have to do a blood test, a screening blood test, to see whether or not your glucose is normal and whether or not you need to be treated as a diabetic. Same thing with this. And when you consider the data that it's such a high cause and effect, not correlation, not link, not association, but cause and effect between the pathogens in the mouth and the coronary disease. And of course, this is present throughout the body. It's just that it's most prominent with the heart, because when you start causing coronary disease, oftentimes your first symptom is occlusion and death, whereas if you have infections in other arteries and other places of the body, you'll develop symptomatology long before you encounter, if ever, a life-threatening event. So this is why the focus comes on this, is because anybody will tell you, you will read in the textbooks too many times, I think roughly 50% of the time, the first chest pain a person has is their last chest pain. So it's really the lucky ones, if you will, that develop evolving chest pain syndromes before they finally develop what could be a fatal heart attack, whereas 50% of them have no problems at all until they just block off that blood vessel completely, and that pain that they have is the pain of the big heart attack and the last pain that they have. But bottom line is the 3D cone beam examination of the mouth, even though it's an involved test, you know, it takes a little while, got to go to the right dentist, should be just as routine in the evaluation of any medical condition, not just the heart, any medical condition, just as readily as getting a biochemistry panel, a complete blood count, screening thyroid test. It should be baseline done routinely.
I don't know if it's true, but if it's true, Dr. Levy, I'm speechless, as you can see. And first of all, thank you. And listeners, if you are listening to this, please comment down below your opinion about, and tell us, is there any dentist told you ever to do that scan? So let us know.
Or a cardiologist, as the cardiologist there,
exactly,
or the cardiologist, either side.
Or the cardiologist, yeah. Which is, of course, it's probably 0% of possibility. Right. So let me say this, Dr. Levy, because I'm facing personally some high blood pressure over the past 5-6 months. And it's ridiculous, of course, because I'm 31 years old. And it doesn't make any sense because, yes, I had some gut issues, but other than that, I'm pretty athletic. I'm really taking care of my body in a pretty good way. Not perfect, of course. I'm not perfect, but I'm athletic fitness. And there was only one thing, Dr. Levy, over the past 6 months, that over the past year, that I did wrong, and that was my teeth. I really messed that up. I was very lazy with my teeth hygiene since early 2021, probably, or late 2020s. And I started having, some issues. And I have some wisdom tooth, which is very suspect to form bacteria or something. And I think even a dentist, a common, dentist, have told me that this is you should probably get that tooth out at some point, because it might cause problems in the futures. But the problem here, Dr. Levy, and I want your professional opinion, of course, I'm trying to find a dentist here that's biological or at least holistic, and that is aware of the scan that you said, because the scan that you said, I just heard it from you, but I had heard this from you once again in another interview of yours. So because of you, and that's why I'm very thankful that you came here and talking to the people. Because of you, I asked the dentist over the past 2 weeks, all right, do you want me to bring you the CBCT scan? And they were dumbfounded. One of them even told me, and this is supposedly a holistic guy. So imagine the other guy. And one told me, what is that? He asked, what? And I was like, what? And then, you know what he told me? Of course, he told me you should probably bring your, he asked me, have you done your vaccine? And I'm like, what? Why is that relevant? And he told me, if you don't have the vaccine, we have an issue. You cannot come here. And this was a holistic guy in Greece. And I'm like, oh, God save us. So what's your opinion? How can we find a proper dentist? I'm not going even to the cardiologist. So let that aside for now, because I don't think there is any cardiologists out there, or at least most of them, that are aware of this thing, or even, what's your opinion, Dr. Levy? Please enlighten us.
Probably the most practical way to approach that would be to, now I don't know that it's going to be a holistic or a biological dentist, but nearly all, and I think this pertains around the world and just not in the States, but nearly all dentists who specialize in or do a lot of dental implants have the 3D machine, because it's pretty much state-of-the-art dentistry and substandard dentistry if you don't use this type of thing, because it allows the dentist to more perfectly understand the unique architecture of your mouth and where is the bone density good for putting the implant and everything else. So I would start by looking at prominent implant dentists that do high volumes of implants, and actually that would end up probably being a good choice too if the tooth needed to be extracted, because then it could get extracted, and depending on the philosophy of the dentist, you could follow up with an implant. However, another group of dentists that have this technology in high percentage are the endodontists, but you have to be careful with the endodontists because they're root canal specialists, and they are completely and totally dedicated to doing root canals. So you could end up getting a good interpretation of your 3D cone beam exam, and before you know it, get your jaw numbed up, and you'll end up having a root canal in that tooth rather than an extraction. And then you've just bought a whole new bag of worms, because 100% of root canal treated teeth are infected.
Wow. Is that true? Is that fact? Have you seen the evidence of? Is that really that worrisome?
Sure. No. The statistically speaking, probably one of the worst things you can do for your long-term health is to get a root canal, because it's usually done because the tooth is infected and painful. And so what do? They cut off the top of the tooth, roto-rooter out the pulp, so that you no longer have pain, but nothing is done for the infection. And this was documented by Dr. Huggins 25 years ago. He coordinated with dentists around the country to send Dr. Boyd Haley of the University of Kentucky, who set up a test to measure toxins inside teeth. And they had over 5,000 extracted root canals submitted to Dr. Haley over the course of a few years. And every one of them, 100%, had incredibly high potent toxins in them. And they did a few regular teeth that were extracted, let's say for orthodontic purposes, for adolescents that needed to get braces or there was crowding of the tooth. So they tested some quote unquote normal extractions too, and there were no toxins. So this was present in 100% of over 5,000 consecutive extracted root canals. I think that's pretty safe to call it 100%. Maybe if there's one out there that's not infected, then you'll have 99.99999%. So that's not the type of odds anybody wants to play that's saying, well, I think maybe my root canal's okay. And dentists that don't understand this or ascribe to this, they just say, well, if the tooth feels good and works fine, it's okay. Well, of course, we're not talking about cosmetics. Okay, we're talking about biology. We're talking about pathophysiology. We're talking about toxins being released into your bloodstream around the clock. When you have a root canal or what's called an asymptomatic infected tooth, that's another thing that the cone beam detects, you have, unfortunately, a perfect system of disseminating pathogens and toxins throughout your body. Because what happens when you chew on a tooth like that? If you're chewing something hard, you generate some of the highest pressures that you can possibly imagine in any biological system between those two teeth. And what happens when you do that? You express the pathogens and the toxins in the lymphatic system and into the venous drainage. You actually inject pathogens and toxins more effectively into your system than with a needle in your vein. So it's just an incredibly, unfortunately, elegant system for disseminating these toxins. And the data is there. Once again, the data is there. It's just ignored for whatever reason. I mean, I'm not inclined to get into people's heads these days or anything like that. But I will say both doctors and dentists as a group, they like their routines. They don't want to rock the boat. They want to do something they've done 1,000 times before, push you out the door, and collect the insurance. And they don't want to be advised that, well, there's a better way you can do this, because then that involves different training, dealing with your personnel, and just, like I said, the doctors and dentists are creatures of convenience, okay? And they steadfastly resist anything that's going to change their daily routines.
Who isn't, Dr. Levy, right?
So, that's true. I mean, that's true. That's human nature. Sure. I don't deny that. But this is human nature when you're dealing with people's lives, not when you're dealing with their plumbing or their masonry or some other service that you're buying. This is your life, and this is illness as well. Even if it doesn't kill you, if something not done correctly gives you 20 years of gut-wrenching illness and medication that you didn't have to take, how tragic is that?
Yeah, I will agree with you wholeheartedly. And, from a personal view, my mother has some of the worst teeth imaginable. This is something that I'm going to share with her, this interview, and that's why I'm going to translate the whole interview into Greek, because I'm going to do this for her and for other people out there in their middle age, probably had their, dental care from, regular dentists, but they are not aware of these things. And what you said about people losing their life, 20 years of having a very miserable existence, I'm seeing this, Dr. Levy, with many things. My brother, for example, suffers from depression for the past almost 20 years, 15 years. He's now 34, and it's sad. I'm not going to lie. It's very sad. It's wasting human potential, and it's very worrisome when you see connections with depression. So, for example, he had a surgery done. He had to remove his appendix. How do you say this, in the belly? The
That's
thing.
right, appendix.
Appendix, yeah, and it was very infected. So he was very close to die. So it was a very bad situation. So he was in the hospital for a month or something. Lost a lot of weight. He got into very heavy medications, very heavy antibiotics. And he was like 14 or something, 15. And from that point on, things got worse and worse. And I think the thing with modern medicine sometimes, like you said, we get into, I think part of, and I'm just thinking here, you are the expert, the scientist, and I want your opinion, of course. But I think that modern medicine, partially the doctors, their habits are to blame, their human nature. And some of them, I think there is some agenda playing. I don't know what is the agenda. I don't know if it's always the doctors trying to, kill the patients. I'm not very sure about that. I don't think that it's the doctor per se that's trying to do so. I think, though, that
your first priority can be making money without your first intent being to harm the patient, even though one can result in the other. Just trying to make maximal money doesn't mean you're trying to kill the patient, but it also doesn't mean you're doing what's best for the patient.
Yeah, exactly. And I don't think that making money is necessarily bad. If you are a great doctor, if you are really healing people, I mean, you can buy 10 Ferraris. If it's up to me, I don't care, to be honest. I see here, Dr. Levy, that it's not that all modern doctors are really bad. But I see many people are very ignorant of that. You probably know, of course, the calcium artery score. But when I asked my 2 cardiologists over the past 6 months, they didn't know it. And when I asked them, is it even useful? They asked me, of course not. It doesn't make any sense. From what I'm hearing from people like you, from other people, it doesn't make any sense.
And you know what you just said underlines something else. And this is true of people in general, but of doctors. He just said, well, I don't really know anything about it, but it's not useful. What are you doing even expressing an opinion about something you don't know anything about? Yet doctors are just love to come out with unfounded opinions and then stand by them like they're etched in stone.
Human pride, Dr. Levy, human pride is the sin of all. The biggest one.
The ancillary part of that human pride is arrogance, and there are no group of people on the planet more arrogant than physicians, because we have probably over 100,000 people a year across the world die in intensive care units with physicians that will absolutely refuse to give intravenous vitamin C, which would save them very easily and very readily. And it doesn't matter how much literature you give them. It doesn't matter how much information. It doesn't matter if you have other doctors who know about this and are willing to talk to it. They just don't want to be told or advised what to do, or that there could possibly be something out there that their glorified brain doesn't know anything about. So arrogance is number one on the list of physicians, in my humble opinion.
I'm very eager to know the number 2 and 3, but I'm fearful to ask. So let's set this aside for the moment, and let me ask you then, Dr. Levy, in your humble opinion, what should a man or a woman do to find a doctor that's suitable to do the 3D scan? You said yes, go to the guy. But how do you proceed to ask them?
You get different dental offices. You get on the phone and you talk to the front staff and you say, I'm interested in getting the 3D cone beam exam of my mouth. I want to check for infected teeth. I want to know if your dentist has this type of technology, and if he or she would be open to doing this test on me. And obviously, if they do the test on me and they find something that needs to be taken care of, and I feel comfortable with them as a dentist, I'm sure I'd be happy to have them take care of my situation rather than just to get the test and go somewhere else. But either way, it's, probably in most cases, it's going to, I don't know, probably average about a $350 test, which is still not exorbitant these days when you see how much magnetic resonance scans and other CAT scans and other angiograms cost. So it's still not that exorbitant in the great scheme of things when it comes to medical and dental testing. But they have to do their own detective work. They got to get on the phone, look online, check under either integrative physicians, biological dentists, holistic dentists, blah, blah, blah. Also, if you have one or can find one, just an extraordinarily excellent type of dentist to end up with is one who uses ozone in their disinfection and their different treatments, because it just eliminates so much pain and so much post-operative infection and difficulty and that sort of thing. But that would be a little bit of a luxury if they could just find a biological dentist who understands the importance of these principles and understands why you want to do a 3D cone beam exam, and then you're at least on the right track. I mean, the opportunities to do different things just obviously vary widely across the planet, in different countries and different cities and different settings.
All right, people listening, you've got to be your own detective. So that's very important what Dr. Levy just said. And I think Dr. Levy, sometimes people want to throw the ball to the other guy. They wait for somebody else to solve their problem. And I've seen this to myself, even myself. And sometimes in this system, like you said right now, you have to do some work yourself. You cannot expect any doctor out there to do the work for you, because not any doctor is the same, right?
Well, I got to say this too. There's so many people. We live in such a different time now, and so many times I'll get an email say, "Doctor, well, what about vitamin C in this?" And I'll just go on to Google, say vitamin C in this, and then link them there. I said, you have in your hands the simplest, greatest access to information of any kind that's ever existed in the history of man. So the first thing you need to do is learn how to use Google, learn how to use Yahoo, type in a few words and see what gets there. Spend 5 minutes doing this, and you're going to get the answer to your questions. And I got to say this too. So I'm 71, and I've obviously used the computer a lot. And even now, I might sometimes ask myself, I wonder what I do, this, and this. And then I say, duh, go on Google or Yahoo, type it in and see what they got there. So I understand how we slip back into old habits of, if we have a question about something, let's see if we can find someone to ask about it. No. First line, go to your computer, and you have to decide for yourself what to adopt and what to filter. I know a lot of the criticism is there's so much garbage on the internet. Well, guess what? There's a lot of garbage in books. There's a lot of garbage in articles. There's a lot of garbage in your garbage can. You still have to use your brain. And when you're talking about a certain issue or a certain point, you have to see how that point is managed across different websites with different expertise and backgrounds. And when you've done that and you see the same piece of information emerging from 3 or 4 different sources, then you can begin to see that this is a good piece of information that you can base some decisions upon.
Yeah.
But you have to be proactive. I mean, if you just say in your mind, I'm just going to go to the dentist, I'm going to go to the doctor and say, here's my warm body, do with it what you will, and trust that they're going to do what's best for you, it's only going to be you that suffers.
Well, I can only agree to that from my own experience. Yes, people, again, take action. Dr. Levy knows what he's saying here. So, and I've seen it from my own self. Many people out there, even experts, the so-called experts, the so-called doctors.
Oh, wait, let me interrupt there. Experts,
Yes.
experts. I love that one. They say, well, this physician who's a professor of medicine at Harvard University that has 350 publications, is a renowned speaker, an expert on this, says this. Well, guess what? I don't care what the issue is. I can find an equally qualified expert that will say the opposite thing. So expert opinions means nothing. That's why you have to use your own brain and look at the consistency from one person to the next and whether they really base their opinions on true scientific evidence. I mean, a lot of people think scientific evidence is the FDA said this, or the CDC said this, or the government said this, or the medical board said this. That's not any type of evidence at all. It might be right, and it might be completely wrong, but that's not scientific evidence. Scientific evidence is an article, and you see how they proceed to test an idea, and when they come out with a result. And if the result is what you're looking for, then you go to several other articles at different institutions and see if they use the same methodology and reach the same conclusions. Then you can start to conclude that something is or isn't true based on scientific evidence. Statements issued by the CDC, the FDA, a pharmaceutical company mean nothing.
That's so refreshing to hear. Honestly, that's great. That's great news. I mean, so Dr. Levy, let me tell you this. One of the two cardiologists I went to was a very, I mean, he had all the credentials, all the credentials. Everything seemed fine. And I'm saying to myself, well, the guy seems fine. Let's go to him to, you know, take his opinion about what I'm having here. And I'm going there, and the guy, he's taking my blood pressure, and my systolic blood pressure is 140. And he says to me, yeah, that's normal. It's great. He told me basically it's great. 14 systolic and 8.5 diastolic, right? So if you go to start deciphering the studies, which nobody does, of course, because who has the time to do so from the people, the simple people, other than you and some people. If you go to the studies, this is ridiculous idea to have a high blood pressure, a blood pressure of 14.5 to 15, and considering, and the guy, the so-called expert that's so highly credited and saying that it's a normal thing, don't worry. Sometimes people, I see them going to offices of doctors and they do not even talk back. So they just take the orders and go home and do what the doctor's saying, and there's no filtering.
Well, I always say, if you have a doctor that you ask a question and they won't answer you, or they dismiss you as silly, this, that, or the other, don't walk out of that office, run out of it. Get the hell out of there.
That's a great idea. I'll do that. You know what, Dr. Levy, I'll do that, and I'll record it and I'll send it to you. And you'll be proud of me.
All right.
Let's talk a little bit about hydrogen peroxide, right? I've heard one of your interviews in the past, and you talk about nebulization of it. So what's your opinion, Dr. Levy, about hydrogen peroxide, and where can it be useful for us?
Well, you know, as I go into this subject with you, you might bring this to the attention of your brother, who's developed so many problems after the infection, and gut problems as well, because hydrogen peroxide nebulization not only works effectively to stop and resolve acute onset respiratory infections, it also clears out and kills the chronic pathogen colonization that most people maintain even when they feel well, because they never did the right thing after they last had a cold or the flu. because pathogens immediately develop biofilms. And when they develop the biofilms, you can take antibiotics from now until eternity, and it's not going to penetrate the biofilm, and the pathogens are going to stay there. Why is it significant? Because even though they don't grow rapidly like something acutely infected or abscessed, they continue to grow, metabolize, produce toxins, and eventually die and release large amounts of iron. And what do you do with that? You swallow it. So 24/7, most people are swallowing toxins and pathogens from these areas of colonization in their nose and throat. And this makes it impossible to have a normal microbiome and impossible to have a tight gut, a non-leaky gut that's going to allow these toxins to disseminate throughout your body. And I certainly can't make any guarantees for your brother, but so many times now, I've had the quick feedback from doctors and people that have said, wow, I started nebulizing and now my bowels are working as well as they ever had before. And I've had 2 years of irritable bowel syndrome. Thank you so much. It's very dramatic how quickly the gut can heal when you stop poisoning it on a daily basis. Which sounds a little sarcastic, and maybe it is, but most people don't realize, certainly the doctors don't realize, that this can be addressed. If it hadn't been in the setting of a pandemic, my book, Rapid Virus Recovery, would have probably been entitled Rapid Gut Recovery. But it does both things. It resolves these acute infections or gives you a good inroad toward resolving those acute infections. And it immediately stops the continued swallowing. The cells in your gut, the leaky gut, the ileum, the cells in the gut where they maintain tight junctions to keep things from leaking, those cells regenerate every 3 to 5 days. So if you stop poisoning it, you can have many people almost a new gut boundary in a week. Okay, so this is why the results can be so dramatic in some people. Now, other people, they've had long-standing problems, and I'm not going to say this is going to be like a magic wand and make those go away, but I've had an enormous amount of feedback from different doctors and patients, and it's very clear that when they manage to largely sterilize, I don't mean sterilize because you always have colonizations, but when you largely sterilize from pathogens, what's going on in the nasopharynx, in the throat, and the oropharynx, you see enormous benefits from the gut. And then the add-on to this is a toxic gut is one of the worst things you can have for general health throughout your body. Why? Because those toxins go through the leaky gut and disseminate throughout the body. There are many diseases that a toxic gut causes. But what's even more important to realize is there's not a disease in existence that a toxic gut does not make worse. And I've had, it's kind of funny, I've had people, patients, doctors write me back and say, wow, I started nebulizing and this pain in my leg went away. What do you think happened? Well, I don't know, but I do know that I just said these toxins go everywhere in the body. So if you had some sort of muscle problem within some part of your body, yeah, it could have relieved that. Might not have, but certainly not out of the realm of possibility. Now, a few brief words, your listeners can know it's only in English and Spanish, but they can download a copy of Rapid Virus Recovery for free. So I can either give you that or they can send me an email and I can give them the links. Okay, so you can feel free to give them my email. What happens when you nebulize hydrogen peroxide, and they've tried to come out with so many things, do differently, like let's not do the easiest thing. Well, guess what? Your body makes hydrogen peroxide. The cells in your lungs make peroxide and secrete it into the airspace. It's the body's natural defense mechanism against pathogens. It's just that when you get too high an exposure, it's more than the body can compensate for, and you need the added hydrogen peroxide to deal with it. That's number one. So it kills any pathogen. Number two is Anytime you take a medicine, an antibiotic, any sort of prescription drug, any sort of natural therapy, you always want to know, what are the residual byproducts? What does this thing break down into? What does it leave behind? A lot of times, not so nice things are left behind, and they can cause their own problem. Guess what hydrogen peroxide leaves behind after it kills the pathogen? Water and oxygen. Now, this is further ideal because the two things a previously infected, injured tissue needs to heal after you get rid of the pathogens is hydration, that's water, and oxygenation, which is oxygen. So the hydrogen peroxide kills the pathogen and then leaves behind the perfect environment for healing. It's designed by nature. For the more religious, it's designed by God. But it's absolutely the most natural form of dealing with an infection. Now, can you hurt yourself with hydrogen peroxide? Sure, you can hurt yourself with anything. All right, if you take the wrong dose, the wrong concentration, this, that, or the other, yeah, all right. Aspirin can kill you. Tylenol can kill you. Anything can kill you if you're an idiot about how you take it in and apply it. But when you follow the recommendations as they're outlined and take the proper concentration or lower for given periods of time, it's about as non-toxic a therapy as exists. And people need to keep in mind that there are some prescription drugs that even when you take them as prescribed, they can kill you a certain percentage of the time. So this is just an extraordinarily simple and, of course, cheap. I mean, one nebulizer, one bottle of hydrogen peroxide can probably treat 100 people. Okay, so that's why you're never going to get the type of data you want to see on this, because the medical industry runs primarily for one purpose. That's not to make profits, but to make obscene, unconscionable products. And they're never going to condone or support anything that you can do for yourself if it replaces a $40,000 therapy. But, you know, the hospitals and the drug companies and the doctors, I'm sorry, they don't care if their bills drive you into bankruptcy, cause you to lose your house, cause your children to no longer have the possibility of a college education. They just don't care. And if they tell you they care, they're lying.
Speechless again. So, yeah, many things to really download in our brains, fellows, listening to Dr. Levy. But what you said about cheap and useful, Dr. Levy, it's one of my biggest questions I always had about medicine. Why do we need to pay so much money to get ourselves semi-healed, not even healed per se, semi-healed? Why? Well, is that even natural? Is that part of nature to do so much, pay so much, just to get a little bit better? It doesn't make any sense. That's why what you said is really interesting. I've never done it. I'm really curious about it. I'm going to, of course, if you are kind enough to send me the link, I'm going to get it down below. Okay. Every link of yours, of course. Having said that, since we are slowly ending, I want you to tell the people, let the people know about your books. Let's talk a little bit about your books, about every book of yours. Why did you write it? Yeah, let people know about your books.
Well, as I mentioned earlier, the first book was Uninformed Consent that I co-authored with Dr. Huggins. And as the title implies, there's a lot of people that get stuff done in their mouth that they didn't really consent to. But once the anesthesia hits the jawbone, dentists can start pretty much doing anything they want, which is why I said always be careful if you see an endodontist for any reason, or you're going to end up with a root canal whether you want one or not. So that laid out the dangers of mercury and a lot about laboratory. The next book I wrote was Optimal Nutrition for Optimal Health. That came from a lot of the work that I did with Dr. Huggins, because I was able to see how different diets and different supplements affected blood work, went into food combining and a number of other things. Then there was Curing the Incurable, the big book on vitamin C, infectious disease, and toxins that went through most of the significant literature over the last 60 years or so. Let's see. And then there was Primal Panacea, which is another book about vitamin C that went more into the not only medical issues, but the political issues of vitamin C, which I've alluded to earlier as well. Other books, I wrote a small book on glutathione, wrote another book, two books, one book with Dr. Robert Kulotz called The Toxic Tooth that concentrated on what root canals do. Then the most recent book, Hidden Epidemic, that talks about the impact on heart disease and breast cancer of infected teeth. It makes it clear that, yeah, root canals are bad, but they're just the tip of the iceberg because so many people have infected teeth they don't know about, which is why we talked about the 3D cone beam examination. Then a book on magnesium and the importance of magnesium in dealing with toxicity in general health. Then the book Death by Calcium on the toxicity of calcium. And then most recently, Rapid Virus Recovery. There's probably one or two more there I didn't mention, but that's pretty much it.
So I have to ask, Dr. Levy, you are a prolific author. How do you do that? So how can you write so many books?
Well, certain unique situations have arisen where I'm not wealthy by any means, but I'm able to make a living without having a clinical practice. So there's a lot of doctors out there that I have a lot of respect for, and I know they could write some brilliant books, but hey, you can't spend 8 hours, 9 hours in the office, do a couple hours of rounds in the hospital 6 days a week, or even 5 days a week, and expect to write a book on the weekend. And certainly you're not going to write anything after you've ground away at something for 10 hours and then come home. You want to have a good meal, watch something, maybe have a drink if that's your inclination, but the last thing you want to do is be straining your brain. And the thing too is a lot of people don't realize, I mean, I've known a long time now, for example, that my writing is best done first thing in the morning. Why? I mean, by the time 2, 3, 4 o'clock has gone around, I mean, you're still aware, you're still functioning, but at least for me, you no longer have the keenness of thought that you did at 9 or 10 o'clock in the morning. So it's opportunity and circumstance that's allowed me to do this, and not having to rely on practicing medicine per se by itself for the past 25 years has given me an enormous amount of freedom to be able to do this.
Well, great. I'm very happy that you did that choice, really. I think that both the writers are needed as well as the practitioners, active practitioners, because one has time to think. And you know what they were saying back in ancient Athens, Dr. Levy? If you work, you cannot be a philosopher. So, and this is sometimes in our modern fast-paced society, especially the Western one, I think that philosophizing and spending some lazy time every day is frowned upon in our society. And I find this ridiculous, to be honest.
Sure.
If you don't have time to think and to ponder and to look at the sunset and spend time with your wife, hug your children, your parents, have some laughs, tell some stories, think, look at the fire, look at the stars. If you don't do that at a daily basis, then why are you here? Why are you even here? What are you, a slave? You know, it's sometimes I'm thinking of all these things, Dr. Levy, and I think this society has to come back to its senses. And I'm very glad that you said this thing about 2 o'clock, about morning, being a morning, creativity guy. I myself the same. I cannot even when afternoon comes, I can only do interviews and fun talk and very lazy job. I cannot be very productive in the afternoon at all. And back in the day, I thought I was lazy, but it's not. I think it's natural. We are morning human beings, beings of the light. We cannot really. We have to relax, Dr. Levy. Do you agree with that? Yeah.
Absolutely. No question about it, Jason.
I'm very glad. Sometimes I think I'm crazy. So Having said all that, Dr. Levy, can you please say to the people where can people find you?
Well, my website is peakenergy.com, P-E-A-K, energy.com. My email, which I welcome people to write me, I will say I'm not there to do consultations, and if you tell me I have this disease, what do? I'm not going to be able to give you an answer. But for general questions and being able to lead you to other sources of information, I welcome making myself available for that, and that's something you can pass along, televymd@yahoo.com. And both my website has links for getting a hold of the books, but I also said, and I can give you this information, to send me an email, Jason, and I'll reply it and give you the links for the free downloads of not only Rapid Virus Recovery, but upon 3 or 4 other books as well.
Wow, very thankful. And I'll do that. And people, you listen to Dr. Levy, go there, find down below in the description every place. So, Dr. Levy, please stay with me for a minute after the recording, if you please. Okay. For anybody else, thanks for listening. Thanks for your attention. So, ciao, everybody. Have a nice day and go to your dentist and do some work there.
Very good.
Yeah.